One of the most devastating problems that a woman can come in with is really a loss of bowel control. And I see a number of women that describe just leakage without even knowing it. Sometimes they have urgency, can't get to the bathroom in time. Women that have loss of bowel control will really feel like they're out of control of their lives. People feel very embarrassed, start withdrawing from what their activities usually are, including travel, participating in different groups, exercising. I've seen people have to quit their job, feel like they can't work because of that loss of control. They can also get depressed because it leads to a sense of isolation and just feeling like they can't go out and about and do the things that they want to do. When we look at the literature, it's up to 1 in 4 women will have problems with loss of bowel control in their lifetime. So that's 1 in 4. That's really very common. But a lot of people feel like they don't want to talk about it. They don't want to bring that issue up to their friends, even their significant other, and they don't want to bring it up to a doctor. The Eclipse system is a really exciting new treatment option. It's a vaginal insert that a woman is able to use, and it's very discreet. Once the device is fit, she really shouldn't feel it. It is that comfortable. One woman that came to the office and described accidental bowel leakage or loss of bowel control had that for the course of about 15 years, and this was getting progressively worse to the point that she really withdrew from a lot of her activities. She was recently divorced and fearful of even going out to meeting anybody else because of the accidental bowel leakage. And to get back control was something that she really, really wanted. She tried the Eclipse system and found that this really gave her back a number of the things that she cherished and even had forgotten that she had lost once she started using this device. She was able to go out, begin dating again, and find that she had control over her bowels. Now, these results may not be true for everybody, but a number of women will actually find that they can rejoin life after using this device. So I'm really excited to have the Eclipse insert into my practice. Again, this is an option that will give women back control and avoid the potential complications of surgery when diet and exercise have not given them the control that they're looking for.